Dana Christensen, owner of Tree Hill Learning Center, Stacy Johnson, founder and president of Your Gal Insurance Agency, and Marnie Farnes, director of programs at Workforce Southwest Washington. We're here to talk about the move that will happen this month when the insurance commissioner makes decisions about insurance rates. And we're here to say we should do everything we can to make insurance more affordable in the state of Washington and hopefully help make decisions in Congress when we return in September to lower those costs. So before I speak and deliver remarks, I'm going to start with Dana. And, I'm going to start with Marnie. And Marnie is going to give remarks first. Thank you so much, Marnie.
Thank you. Well, good morning, almost good afternoon. Thank you for having me. I am Marnie Farnes. I'm Director of Programs with Workforce Southwest Washington. We oversee workforce investments and partnerships across Clark, Cowlitz, and Wahkiakum counties here in Southwest Washington, where we align funding, programs, and strategies so businesses can access the talent they need and workers can access training, jobs, and career pathways. So we're here today because the threat of rising healthcare costs poses serious challenges for both workers and businesses, especially those operating on thin margins. Our focus industries at Workforce Southwest Washington is generally manufacturing, healthcare, and construction here in our region. Those industries offer strong long-term opportunities for workers, but they're not immune to these rising healthcare costs and the pressures that come with them. And it's not just these key sectors that will feel the pinch. Of course, many businesses, especially entrepreneurs, Main Street businesses, and other small employers in our region, they're already under strain. Healthcare is one of the highest costs they face, as we know, often costing $800 a month or more per person. So for many, that's simply not sustainable. And if premiums rise as they're expected to, we'll likely see increased job losses, reduced hours, and more costs pushed on workers. Even at my own organization, if costs rise significantly, we may have no choice but to pass those increased costs onto employees like myself. So in the construction industry, where most firms are quite small, this challenge is especially clear. Workers often rely on their partners' plans, they purchase coverage through the state's exchange, or they go without insurance altogether, which of course is the most unfortunate. On another note, recently we're starting to see rising numbers in workers being laid off through no fault of their own in our region. People who suddenly find themselves without coverage and limited options. These individuals are doing everything right, and yet rising healthcare costs leave them with few good choices. So my organization over the last 5 years has done a lot of talking with community members, finding out what they consider to be a good job. What we've heard over and over, it comes down to competitive wages, healthcare and benefits, predictable schedules, growth opportunities, and safe working conditions. But one thing is clear, one thing that comes up over and over is healthcare and benefits. And for businesses of all sizes, it's a critical tool for attracting and retaining and supporting a reliable workforce. So in closing, affordable healthcare is not a luxury. We cannot look at it like it's a luxury. It's essential to business stability, for workforce resilience, and a healthy economy. Thank you. I'm going to introduce Dana Christensen next. Thanks.
Thank you for coming. Welcome to my school, Tree Hill Learning Center. I took over this location in 2009 and built my second location in March of 2020. Real good time. We proudly serve over 260 children, and we employ nearly 45 dedicated teachers, cooks, and administrators here. The childcare industry operates on very thin margins, which makes rising healthcare costs incredibly challenging. I view providing health benefits not as a perk, but as an but as a fundamental necessity. It's non-negotiable for me, as I never want an unforeseen illness to financially ruin an employee or force them to neglect their health. I truly care about my employees' well-being, and while I strive to increase hourly rates, it moves them well beyond any eligibility for state or federal assistance. Each year I face the difficult decision of how much of the rate hikes, currently at 24%, do I take on and absorb? How much do I pass on to the employee? How much do I pass on to the families in the form of tuition increases? And most painfully, what benefits I might have to cut. Our child care staff are the unsung heroes, shaping the minds of our youngest children. They deserve more than just appreciation. They deserve a comprehensive and robust health care plan. Denying this undermines the very foundation of our child care community and economy. Healthy and financially secure staff provide better care. When my teachers are not worried about their financial well-being, they are more present, more engaged, and create an environment for children that can truly flourish, which is our ultimate goal. Let's even address a bigger issue. We are facing a significant child care crisis in our state and across the nation. Staff turnover and retention are constant issues. A robust health care plan can stabilize the workforce and serve as a crucial recruitment tool to attract the best teachers for our children. Moreover, escalating childcare costs are forcing families to choose between their job or putting their children in unlicensed childcare situations. This is why I work diligently to avoid blindly passing these rate increases onto my families. We cannot solve this problem alone. We need the support of lawmakers, the insurance industry, and regulatory agencies to address the root causes of these rate increases that are disproportionately affecting those who need it the most. The path forward demands courage, creativity, and an unwavering commitment to our employees across all small businesses. Thank you. And I will introduce Stacy.
Thank you for having me, Senator Cantwell. My name is Stacy Johnson. I'm a local insurance broker and the owner of Your Insurance Gal Agency in Vancouver. I work with group insurance, the individual market under age 65, and with Medicare beneficiaries. Today I'll be speaking first about individual health insurance and then Medicare. Based on early indications, individual market health insurers will introduce the largest hike in premiums since 2018. Each spring and summer, health insurers submit rate filings to state regulators to justify premium changes for the upcoming year. Premiums will be rising in 2026 due to 7 key drivers. First, rising medical costs. Hospitals, doctors, and outpatient services are getting more expensive. Regents alone estimates that more than 10% annual claim growth is what they're experiencing. High-cost drugs, specialty medications, and GLP-1 drugs like Ozempic and Wegovy are fueling double-digit pharmacy cost increases. Labor costs. Workforce shortages and inflation drive providers to demand higher reimbursement rates. Provider consolidation. Mergers reduce competition, allowing providers to charge more. Loss of enhanced premium tax credits. Subsidized enrollees are generally shielded from annual rate increases as their tax credits keep premium payments capped at a portion of their income. However, subsidy expiration could add 3 to 5% to Washington premiums and raise net costs by 75% or more. Federal rule changes. New rules may push healthier members out, worsening the risk pool. And last but not least are tariffs. Possible import tariffs could raise medical supply costs and drug costs, though most Washington insurers haven't even factored this in yet. The impact of the above factors will have the following consequences. Bigger monthly bills. Most will see double-digit hikes. Without plan subsidies, premiums could jump hundreds per month. Less choice. Healthy members drop off may lead to fewer plan options and smaller provider networks. More uninsured. Higher costs could push many to go without coverage, raising costs for those who remain. And ongoing pressure. Drug and provider cost growth will keep premiums climbing in future years. The bottom line for Washington? 2026 premiums are being driven up by a mix of rising healthcare costs, expensive new medications, workforce shortages, and policy uncertainty, especially the possible loss of enhanced federal subsidies. Without congressional action, the combined effect will mean sharply higher premiums and coverage losses for tens of thousands of Washingtonians. What premiums and reduced benefits could mean for Medicare beneficiaries in 2026. Higher out-of-pocket costs. Medicare Advantage members will pay more. Average out-of-pocket costs are up 5% in 2025, ending several years of steady declines. Most members, up to 70%, will feel increases directly in their wallets. They'll have fewer plan choices. The number of plan options per beneficiary has dropped for the first time in years. In 2025, nearly 10% of beneficiaries lost access to their current plan and had to shop for a new one. This trend is expected to continue in 2026. Cuts to supplemental benefits. Many plans are cutting back on popular supplemental benefits such as dental, vision, and over-the-counter allowances. Fewer members will have access to comprehensive dental coverage and generous over-the-counter allowances. Less value and more scrutiny. As costs rise and benefits shrink, beneficiaries will need to review their plan options and may have to settle for less coverage or higher out-of-pocket expenses. Plan switching is expected to rise as people look for a better value. The bottom line? For 2026, Medicare beneficiaries should expect to pay more and potentially receive less rich supplemental benefits. In some counties, companies are likely to exit the market altogether, as high utilization and increased costs have made plans unsustainable. Senator Cantwell?
Thank you so much. Well, I want to thank all three of these, Dana, Stacy, and Marnie, for putting a face to the story of what Washingtonians are struggling with in the future of higher health care costs. That's why we're here, because we're trying to sound the alarm so that we can fight back. We're here today to say that insurance costs that will rocket soon if the insurance commissioner moves forward are expenses that Washingtonians can't afford. This is a real threat to our health care affordability. It's a threat to individuals, small businesses, the workers that they employ, and, as you just heard, to the quality of health insurance. And that is why we have to fight to keep these provisions of the Affordable Care Act. The Washington Office of Insurance Commissioner announced a few months ago that they had received a lot of requests to increase the rates by 21% a month, premiums by 21%. As you just heard, the largest increase in recent years and nearly double last year's increase. And they will decide this issue this month, in the month of August. That's why we're here to sound the alarm. We know that increased rates are something that we could deal with in Congress. In fact, some of those applications actually cited Congress's inability to act as the reason why they expected rates to go up. They cited the impending failure of the tax credits and the rising cost of providing health care because of tariffs and inflation. The Office of Insurance Commissioner will have to decide what to do in this situation. That is why today I am urging Congress to take action to save the Affordable Care Act tax credits and their expansion, and make sure that we do that before the end of this year. To put this looming threat into perspective, let's review how we got here. The Affordable Care Act that Congress passed in 2010 made health insurance through Medicaid and the marketplace with exchange available to millions of more Americans. This increase in affordability led to a record year of coveraging American citizens and the lowest uninsured rate, 7.9% in 2023. That was good news. Today, 44 million Americans are benefiting from that coverage through the Affordable Care Act, representing about 1 in 6 people under the age of 65. In our home state, obviously 626,000 Washingtonians and nearly 300,000 on the exchange received more coverage. And that includes people here in Southwest Washington that were helped by the premium tax credits. It also helped the self-employed and small businesses who had really challenging times getting access in the marketplace because they weren't like a large employer who was negotiating on their behalf. So this is why the Affordable Care Act was so important. But all these advantages, the increase in coverage and rates and the health insurance affordability, are now at risk. Last month, we tried to put this issue on the table during the reconciliation budget fight and tried to protect these credits. Obviously, our colleagues did not agree. The vote failed on a 50-50 tie. So without the extension of these tax credits, a family of four will receive less premium help and credit, and obviously their rate, as you heard, can go up hundreds of dollars a month, and in fact, thousands of dollars a year. Now is not the time to be making health insurance more expensive. According to the Kaiser Family Foundation, aggregate uncompensated care costs dropped by $20 billion in the 7 years after the passage of the Affordable Care Act. We heard this from Marnie when she was going through these numbers. When you have less people covered, then they go to the hospital, the increased cost in uncompensated care goes up, and then everybody's insurance goes up as well. So, why did Republicans vote to reverse these important savings? And why have the uninsured level and uncompensated care level increase? That's why it's important to fight this. We know that the business and the marketplace deserve to have affordable health insurance. And as mentioned, the tariffs aren't making it any easier because both supplies and pharmaceuticals are also going up. A new Kaiser Family Foundation analysis says that insurers who are citing tariffs for increased health care costs are saying they're raising those premiums by an additional 3% above what they would have requested because of the tariffs. So, in a time when everything else is even more expensive, groceries and household goods, the last thing we want to do is make health care more expensive too. So, that is why I am sending a letter today to Chairman Crapo and Wyden, the two ranking members of the Senate Finance Committee, asking them to have hearings and a markup on legislation that would help preserve the affordable health care tax credits and save our affordability in this system. I'm urging them to do this as soon as we return in September and to find ways to make health insurance more affordable for American families. Being insured and being able to get care when your family needs it is the way to stay healthy. It is the way we can focus on the important parts of achieving their goals and being healthy and delivering in their workplace. So these important issues, especially critical to small business and critically important to small business child care providers, because they are the ones who have such a tough time making ends meet anyway, and yet that is what makes our whole system work. Having affordable child care, having them be able to carry a workforce that has affordable health insurance, as we just heard, is critical to keeping this sector going and keeping our whole economy going, because that allows their parents to go to work too. So without these small businesses, it would not be possible to start your family, establish the community, have the economic growth, and that's why we're here today at this child care facility to emphasize this issue. This is really where the challenge begins. We're here today, again, to sound the alarm, to say Congress should act to preserve the affordable tax credits. We should make health care more affordable, not less affordable, and we should keep the Affordable Care Act system going. Let's have Congress relook at this 50-50 vote. Some of my Republican colleagues have said, 3 or 4 of them, that they want to do this. So let's get at it in September. Let's prove the insurance commissioner wrong. Let's get these tax credits continued and keep health insurance more affordable. Thank you very much.